Hi there, just take a seat. Hi, I'm Dr. Murmurs. I specialise in physiotherapy. Welcome to my clinic. Can I just confirm a few details to make sure we have the right patient? What's your full name? And your date of birth? Such a nice month to have your birthday in. Okay, and can you confirm your address for me? Yep, okay. And your postal zip code? Alright, I do have a contact number on here. Can you just confirm what that is? Alright, okay. Definitely got the right patient. So, I just have listed here that you have some sports injuries you'd like me to take a look at, but I don't have any further information. So, would you like to talk me through your injuries? Can you confirm which sport you play? And how long have you been playing that for? Oh, I see. Okay. So you got a few. Okay, so there are 3 injuries. Alright, why don't you talk me through the first? Okay. How long have you had that for? Okay, and what have you done so far to try and relieve some of that pain? I see. Okay, and then moving on to injury 2. Your arm, elbow, and down to your wrist. I see. Okay, how long have you had that injury for? And have you done anything? Okay. Alright, and your final injury? Both legs. I see. How did you do that? Okay, and how long have you had that for? You have had some treatment, but okay. Nothing worked so far. Okay. Alright. So we do have quite a few injuries there we need to look at. Can you also confirm if you have any medical history that I need to be aware of? Yes, have you been diagnosed with any conditions or anything like that? How long have you had that for? Okay. Alright. And are you on any medication at all? Okay. Okay. Do you have any allergies I need to be aware of? We will be using some oils on your skin today, so just to make sure there's no sensitivities there. Okay. Great. No, that's good to know. Okay, so the first thing that I do prefer to do before we assess your injuries is I'm going to do a quick listen to your heart rate, your lungs, and your blood pressure, okay? Before we start any treatment. Alright, if you can lift your top up gently for me. you. Okay. Just gonna listen in now. Okay, I'm just going to move this around the back. I just want you to do some deep breaths for me. So breathe in and out. Breathe in and out. And breathe in and out. Okay. No issues there at all. Your heart rate is about 86, which is fine. Alright, I'm just going to get the blood pressure monitor out. Okay, just want to slide your arm in there for me. Perfect. I do like to do this 3 times, take a little average just to make sure we get the right reading. Often people's blood pressure can be a little bit high at first. White coat syndrome. Okay. I'm just going to pop this on the cuff. Okay. Let's get some air into this. Okay, here we go. Next one. And one more. Okay. All good. You are 119 over 76. So perfect. Right. Just see if you can pull your arm there. I'm just going to push a little bit of air out that. There we go. Slide your arm out. Thank you. Sport injuries are definitely not fun. I've had my fair share. I used to be a cheerleader, and I tore my rotator cuff my last year of cheerleading, which was unfortunate because I was vice captain at the time, and I couldn't perform on show. So it was, I can understand and empathise how upsetting sports injuries can be for everyone, indeed. But not to worry, we'll try and get you fixed. See if we can help you out, okay? So let me just note that down. So we have 119 over 76. Okay. So I am going to just take a quick drink, and then I'm going to assess your injuries. I will need to palpitate your muscles. So do let me know where you feel pain, okay? So my understanding is it is your right shoulder. Okay, just try and relax for me while I have a look. So if you can actually lift your arm up for me above your head, so you're just getting it to there. Yeah, that does look like a rotator cuff injury, similar to my own. Okay, I'm just gonna palpitate the muscles. Let's just see. Okay, tell me where it's sore. Okay. Yeah, I think it is your deltoid. Yeah, I think we may have a little tear in there, but I do think we might be able to help release some of the tension off that, because you're very knotted there. Yeah, we'll see if we can relieve the tension around it, but I think you have a just a very minor tear. There's not much we would do medically for that. You just need to help it, let it kind of heal. But if I put some, eucalyptus and other medicinal herbs into it, it will help promote that new cell growth. Okay, all right. And your other injury on your left arm. Okay, elbow here. Okay, just bend your arm down for me. Okay, then fold it up like this. Okay, and then push out to the side like this. Keep your shoulder in. Oh, I see. There. Yeah, you definitely pulled your supinator. Yeah, the muscle comes up here and goes right around there. So, yeah, let me have a look at it. I can't feel any tears or any bulges in the striations. I think it probably needs a good working out. But there may be just kind of similar to your shoulder, kind of micro tears in there. We can definitely work at it and see if we can work out why it's spasming like that. Alright, and then is your right? Oh no, it's both legs, isn't it? Okay. Now, the fact that it's both legs suggests to me that it must have been a movement that caused it. Yeah, I doubt both are torn, but okay, let me just feel around your guts. Let's see. So it's there. Yeah, it's really tight there on both sides. You've definitely pulled them. Yeah, it needs worked into quite a bit. For sure. Just looking right at that. Yeah, for sure. We're going to need to really work into that. Make sure that we get everything right, yeah. And I think as soon as we work in and relieve the tension, because that's why you're feeling the pain further up, is because these parts are very, very tight. They've almost spasmed and gone into a ball. Alright, okay. So I think a small tear, right deltoid, pulled supinator, left arm, and very tangled. Okay. Alright. Well, what we're going to do now is I am just going to prepare the oil that we're going to use today, okay? We're going to use a vitamin base oil. And then we're going to add quite a bit of eucalyptus and a drop of rosemary as well in here. And then I will send you away with some ibuprofen as well, okay? So, eucalyptus. smell wonderful. So we're going to put 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 drops of eucalyptus in there. We want a really eucalyptus infused oil. It's going to really help with inflammation. And then we want some rosemary. Let me just have a quick look. There we are. I'm just going to do 2 drops of rosemary. Okay. 1, 2. Give that a good stir. Perfect. Done that. No, it's ideal. Alright, I'm just going to come across here. We're going to start with your shoulder. I'm just going to tap it on. And you just need to let me know about the pain. Remember, this is not a relaxing massage. This is a medical physio procedure that we're doing today, okay? To work out this muscle. So I'm going to be very careful with this tear here. And really help the new cell growth. Okay. How's the pressure? Okay, good. How's that feeling? If I push down on here, is that still sore? Okay. And how about here? Okay, lift your arm up for me. That's it, let me just feel the tension there. You want to push this out. Okay, and lift your arm back down, and then lift it back up again. Is that relieved it quite a bit? Okay. Right. So, I've worked that out as best I can. So what you need to do is put some ibuprofen on it. You've got a bit of inflammation. And then just keep doing those exercises, lifting your arm up and down, and, you know, rolling your shoulders as well. Alright. Let's take a look at this elbow. Okay, I want you to hold it out like this for me, so I can really work at it while it's position that it's painful. And then move it that way. Back this way. And then back. And the other way. Out, and then how's that? A lot better. And then you want to zip it in, pronate your arm. Okay, you're just going to keep working on that for me. And again, we'll use my ibuprofen to apply just some gel. Okay, if you pull your legs towards me, and I want you to, on your heels, and I want you to flex your toes. Okay, so we can get tension here in your glutes. And I'm just going to very gently, I don't want to cause you to pull them, but I'm going to gently work at them. Yes, just in the past my legs like this. Thank you. Right. I'm just going to gently work at each one, so this side. See how they're already releasing. Yeah, you've just might have been cramped, to be honest with you. Okay, let me try the other one as well. Yeah, keep those toes bent. Yep. Where are you feeling the residual pain? I don't look. Okay, now bring both your feet down. Relax, yeah. And then, flex your feet again. And then relax. How's that? It's released. Good, that's exactly what I wanted to hear. So I don't think there's an injury there at all. I think it's been cramped that's not been able to relieve itself. So just make sure that your iron levels and things are and that you're drinking enough water, plenty of electrolytes, okay? Alright, so we have sorted out your oils, your injuries. So I'm going to prescribe you with ibuprofen. The gel, I just want you to put it on your shoulder and your elbow just for the next 3 days. See how you get on. You might find some more stiffness once this wears off tomorrow, but just keep using the gel, keep doing your exercises. So yeah, rotating that shoulder, moving your arm in and out, and also flexing and unflexing your feet. Alright, if there's anything else that you need or you don't see any improvements within the next week, just give us a wee phone back. Okay, well, it was a pleasure looking after you today. You take care, okay?